Welcome back to PsycheTruth, everybody. I am happy to be here, and I'm looking forward to working on the beautiful model, Michelle. We're gonna work on her neck and shoulders and work out any kind of compression in that cervical vertebrae. So let's get started. So first, I usually like to tune into my client, especially if we have neck, shoulder rolling or obvious shortness. I'll tune in with the collarbones. Michelle has a bit of shortness across her pecs, which can tug and pull on the neck and the cervical vertebrae. So we're just gonna feel into that tension and see where it takes us. It can be nice to go gentle in the beginning if they're just getting used to your touch or being touched in that area. And if they're already warmed up, you can go a little bit deeper. Michelle here is a little bit warmed up. So we're going to focus on this right trap over here. And I'm not really digging as hard as I can, but I am giving her significant pressure underneath as I grab the trap and drag my fingers away from her shoulder. This one feels really good. But I do always encourage a little bit of traction in between each move or working on each side, just to make sure that the neck is integrating, trying to create a lot of length in that cervical spine. I think a fun tip I learned a few years into my massage practice was that the tension and the pain felt on the pec and the shoulder on the left really relates to the sternocleidomastoid and the scalenes and the trap on the right. So they cross. If you can't figure out what to work on to get your shoulder to stop hurting, sometimes it's the opposite side. So right now I'm just digging my finger up under the trap, following the edge of the spine, getting some pressure into the erectors and the erector attachments up in the cervical spine, which has led me to her levator scapula back in here. This particular area can be sensitive and extremely tonified and tense because it's what supports our neck as we either hold our head up or push our head forward. It's strained a lot when we look at computer screens or when we hunch. So be considerate when you start digging in there. And I'm going to take this time to shout out to our Patreons, Hawk Ogun, Rafael Blanco, and Matthew Carlson. And so now I really have her right at that sternocleidomastoid, all the way around to the erector on the back of her neck, and I'm just kind of squeezing it. If you feel a heartbeat, you really are a little bit too close to the blood and the veins, so just gently release it and move over. And I don't know if you can see, but when this is very tonified, it's hard for us to get much pressure or into the deeper crease in the occipitals, in the back of the skull, back of the neck area. So as we've lengthened her sternocleidomastoid, her scalenes, her trap, the right collarbone has been able to set down and widen, and it's given me more access to this denser tissue in here. I'm kind of doing two things at once. I have that great grip on the left hand where I'm grabbing the sternocleidomastoid all the way to the erectors. I'm doing it on the left, and I'm kind of penning those tense muscles and bringing my middle to, middle 3 finger strength, pushing up into the bottom of the skull, almost like negotiating peace. Excuse me. And remember, I said they relate to the opposite side, so her right pec is now calling out to me because the left side of her neck, sternocleidomastoid and scalenes, are pretty dense. And it's time to give them some relief. It can feel really good to strip the scalenes, but be cautious. Like I said, this area of the neck, for some, they can take as much pressure as possible, and for others, it can be a little startling. So now I'm going to try and focus my attention on this left collarbone over here. If you guys have noticed, this really has widened up and this right collarbone has dropped. The left one we haven't worked on as much. And it is still hovering a little high. And I'm gonna petrissage both rhomboids to traps, stimulating both sides of the nervous system here. There's a trick in massage therapy school I learned. Sometimes when you have an injured side or a side that holds more resistance or challenge, it can be helpful to work the opposite because your brain can learn from the development and the work that's done on the opposite side and internally apply it to the injury or pain side on the other. You can see her collarbone really is starting to come down and be in a similar position as the right. Still working on it just a little bit. It's nice when you can see results that quickly. When you work the neck, it can be really helpful for the patient to practice breathing into their belly. The parasympathetic nervous system lives in the gut and in the abdomen. And the sympathetic nervous system really functions in this area, which means that your fight or flight automatically activates your neck. Your stress activates your neck and shoulders. That's where that part of the nervous system resides. So when I pin or squeeze the sympathetic parts of your nervous system and ask you to breathe into the parasympathetic, it's kind of like a nice little nudge into relax. One more time, let's breathe into the belly and let it go. And that was the chest. So we're going to work on this. Pretend like your chest isn't moving. And the only thing that is moving is a balloon inside your belly. It's a bit hard, isn't it? Let's do it this way. If you want to with your client, Michelle is going to help me. I am going to put my hands right on her chest bone here and push down. I'm going to get you to inhale, and I'm going to be soft and breathe with her. Breathe in. And exhale. And I'm going to push down just to her limit. And again, inhale. And now I'm resisting her. And exhale. Push down. There we go. Now when you breathe in for your belly, we're going to start with your nose first. That was better. And exhale. There we go. Engaging with these parts of the nervous system, take intention and practice. A massage can really help. Sometimes we can't feel these aspects of our body or our systems without someone touching them and palpating them, so the brain can take in that information. Do a little pressure on my middle fingers up into the occiput. And now I'm gonna just gently tug as if her whole spine is following one vertebrae after the other into traction. And apply a little pressure right on that temporal lobe, those muscles on the side of the skull that can usually handle a little good digging in there. Petrissage, alternatively with each hand on the traps. Create the traction all the way up the back of the neck to the base of the spine. Now I feel a little more free to work these pec minor, pec major, anterior deltoid. And the whole idea is we're widening out the pecs and that distance between the front of each shoulder, and then tractioning the cervical vertebrae up and out within their comfortable limits. All right, you guys, and that completes our video. I want to thank everyone for joining me on this video today. I hope it was educational and answered any questions you have. If you like videos like this and you're interested in more, please check out our Patreon page. Otherwise, I'll catch you guys next time. Have a good week.